Hi guys, my name is Chaya Chohan and I'm the owner of True Smile Dental Practice. At this moment in time, the dental practice is closed due to the health body guidelines to try and prevent the spread of COVID-19. So this terrible COVID-19 is affecting all of our lives. So unfortunately, most dental practices are all shut. You won't be able to access any dental treatment at this moment in time. So I'm just doing a series of videos just to help you, give some advice as to what you can do if you have certain dental problems. So today we're going to be talking about loose crowns or bridges or veneers. So if you've had crowns, bridges or veneers, you may notice that they are stuck onto the teeth and usually they're not a problem. However, if you have any hard or sticky foods, or sometimes just over a matter of time, the cement gets a bit old and you may find that your crown has come away. So here is my model of a tooth. It's my giant teeth over here. This one is a crown that's come away. So this is just sort of some advice as to what you can do. So one thing is that if it's not hurting you, the tooth itself is completely fine, it's nice and clean, the crown being off is not a problem, I will say just don't throw your crown away. It's very expensive and it's very important. So just keep it nice and safe and put it away in a nice envelope, and then when the dentist reopen, you can take it back to your dentist and they can perhaps re-cement it back into position. But in the meantime, make sure that you keep your area, the area where the crowns come away, nice and clean. Basically, lots of really good brushing, make sure the gums are nice and healthy, lots of flossing. Say if the crown or bridge or veneers come away and it is painful, it's sensitive, and you really want to try and get this back on. There are things on the market that you can use to try and re-cement these things back in. So I'm just going to go through a process of what you can do to try and re-cement it. So first of all, imagine your crowns come away, check the inside of your crown, make sure that it's nice and clean. If there are any bits on the inside of the crown, try and clean it away best you can. Use your electric toothbrush, you might need to use sort of a pair of tweezers or something, so make sure that you've got a nice clean area on the inside of the crown and there's no other bits or bobs or anything like that. Secondly, make sure that you clean the actual surface of the tooth that you're about to re-cement the crown onto. So just give that a really good brush, make sure there's no food debris, make sure that there's no sort of bits of cement or anything on there, so it's nice and clean surface. So you've got two nice clean surfaces over here. What you can then do is just try and practice putting the crown into position. Now this may take a few attempts because it's a bit awkward trying to do it in your own mouth and you're probably looking in the mirror and you're trying to get the right angle in. So remember, it may well be that you've got it the wrong way around. You might have to twist it around a couple of times. Oh, I've just dropped it. Hold on, I'll go and get it. You might do that, you might actually drop the crown on the floor. If you do, then make sure you sterilise it, clean it out in some Dettol or something, antibacterial. You don't want sort of food stuff from the floor onto your mouth. So back to our tooth over here. Try it on, don't force it on, because if you do, then you might break the tooth, you might break bits of the crown and you don't know what you're doing, and then you're in worse trouble than what you started. So try it on, and then once you find that if it goes into a comfortable position, then see if you can just practice taking it in and out a couple of times. And then if you have some temporary cement, you can mix it up, place it into your crown. So the best place to place it is, don't dump loads in there, because when you put it in, it's going to be really gunky in your mouth and then you're not going to know what you're doing. Put in a minimal amount, place it around the edge, on the outside edge of the crown there. I don't know if you can see that, even just around the edge and a little bit right in the middle. So don't fill it all the way up, otherwise when you place it in, it's just going to squelch everywhere and then you're just going to have like temporary dental cement everywhere, and then it's going to taste horrible, and then you're going to be scraping it off the rest of your teeth. So once it's on, once you've put your little bit of cement in there and this is nice and clean, place that into position and gently bite together. Don't force it down. If the bite doesn't feel right, then just immediately take it back out because it's not working. But if your bite does feel right, then bite down, look inside and clean away any excess bits of cement. So if you didn't put too much on to begin with, there shouldn't be too many excess bits, but literally flick away any bits of cement around and just go in between and floss in between the teeth as well. When you do floss in between the teeth, what you can do, I'm going to show you if I can demonstrate this to you with one hand, which I'm not sure that I can do, is get your floss, there you go, and put it in between the teeth like so, but then just kind of thread it through like so, because obviously if you put it in, usually what you do is you put it in and then you flick it back out, but when you flick it back out you might actually flick the crown out, so just thread it through and try and do that on both sides basically. I've just lost a bridge off the front, so I'm going to have to try and do that on the front as well. So try and do that until the cement has gone hard, and if it feels comfortable then that's great, and then when the dentist is reopened then go back and see the dentist. Now if you're not able to put that crown back in and the tooth is sensitive, then what you can do is just keep the crown safe anyway, don't throw it away, but you're not able to re-cement it yourself because you can't get the angle right or it's too difficult, then what you can do is get some of the temporary dental filling and you can just make a, cover that stump, that root stump over with it. So what's happening is that root stump may well have become exposed because that crown has come away, so it's been nice and snug inside that crown. Now that it's come away, it's exposed to hot, cold, sweet, and it's like sharp or sensitive, so you can cover it over and just be careful with it, and then once the dentist is reopened, take your crown along and then maybe they can re-cement it, or maybe you might need another one. I hope that's been really helpful, guys. Thank you.